Hi, I'm Kathy, nurse injector for Dr. Michael Workman, and today I wanted to talk about hyperhidrosis, and that's the medical term for excessive sweating. We offer a treatment for hyperhidrosis or sweating. We use a product called Xeomin. It's a botulinum toxin derivative, much like Botox that you've heard about. It's a really great treatment for this condition. And I can say personally, I have this done about once a year. I had a really hard time with excessive sweating and could really not buy white clothes. Today we're going to treat Kay, our receptionist, who many of you have probably met, and she kind of suffers from a similar condition. What we do is we dilute the product, and then we do a series of very small injections in the armpit or axilla area. So we've had some topical numbing cream on Kay for about 15-20 minutes to make it a more comfortable procedure for her. So let's go ahead and get started. Are you ready?
I'm ready.
All right, let's do it. Okay. First we're going to cleanse the skin with a little bit of rubbing alcohol to get all that topical off of there and to disinfect the skin. And basically, the reason that this works, there are little muscles that actually push the sweat out. So much like using a neurotoxin in the face to inhibit wrinkles, this inhibits those little muscles called arrector pili from pushing the sweat out of the tissue. So that's how it works. And we will have just a series of little tiny injections. Here we go, Kay. Are you ready?
Mm-hmm.
And it's a lot of little pricks, but with the topical, it's pretty tolerable. How's that feeling, Kay?
It feels just fine, actually.
Good.
Don't hardly even feel it.
I have had this done without topical, and I'm not a fan. Why hurt if you don't have to?
Exactly.
Like I said, I think this is a wonderful treatment. I think Kay would agree. It has allowed me to, again, buy a white blouse and not throw it away after 2 or 3 wearings. You know, people are always curious the cost. It takes an entire vial, and at $10 a unit, that's fairly expensive. So we're offering this treatment at $8 a unit, or a total of $800, which is a pretty significant savings. But, you know, I feel like it's important for people to be able to access that. You know, summertime's a great time for treatment, you know. On average, this lasts 6 to 7 months, but remember that's an average. For myself personally, I only treat once a year. I know we treat Kay usually twice a year. Mm-hmm. So it just depends on the person and how you metabolize and how your body responds. And hope to see you in the office soon. Thanks.